Okay, so I am here today talking to Monica Jones from 3D Studios, and I just wanted to talk a little bit about healthcare providers and the whole idea of marketing and the sort of some of the business side of that. And knowing that a lot of my clients are healthcare providers, psychologists, doctors, physical therapists, and so on. And many times they are like so into the business of doing their work that it's hard for them to look at the what they do as a business, and
Right.
that they have to do things like accounting and and marketing and sales. And it's like sales, I'm not selling, I'm in help, that's what I
Right.
do. And so I wanted to just kind of get some information from you, as a marketing person, marketing expert, as to like what you might say to a healthcare provider first about that. Is it okay for them to be selling and marketing, or should they be more professional? Is it more professional for them to not do that and sort of just rely on being set up with certain insurances and just getting referrals from that kind of thing? What do you say about that?
Well, I know that sometimes the old school thought, you don't market, you're a doctor, you're a psychiatrist, you're a physical therapist. It's not appropriate, but those days are kind of gone. And competition is at an all-time high in all areas, in all industries. And you have to find a way to stand out, to make people, they have a choice and they have to choose you. And so there's no harm in kind of making sure that people know that you are an option that they can choose and give them the reasons why you are the right choice for them. And it also will help you to selectively choose who your best patients are, who would be best for your practice, so you can focus on bringing in the people who would be uh, the best fit for your practice.
Okay.
So there's no shame in doing it. I mean, I'm not saying, you put a 1-800 lawyer ad out, but there are things that you can definitely do that will help you get a little bit more visibility, that'll help you get to bring in more clients, better clients, the right clients, to help you grow your practice and grow your business.
Right. So just tell me like a few of the things that you feel specifically for healthcare providers that would be good ideas that they could do.
So, um, I want to start off, and this is kind of how we do with our clients, but I would start off with not the marketing side, but the service side.
Okay.
So I have a list of things that I could tell you that you should be doing, you need to be doing to really promote properly your practice. But before you do that, what you need to be thinking about is the patient experience.
Mm.
What is it like when they interact with you? What is it like when they interact with your office? What's it like when they call in? What kind of reception do they get when they show up for their appointment? What does your office look like? I mean, I know it seems silly, but whenever I talk to, and we have a number of clients that are in the field, and whenever I talk to their clients, their patients, the things that most stand out is their interaction, the things that they're talking about, the things that make them refer someone else to you is the experience that they have when they come to see you, the experience that they have when they pick up the phone. And there's nothing that will kill a client faster than to have somebody rude on the phone. I can't tell you the number of times that I've had somebody come to me and go, "Oh my God, this doctor's office, they're the worst. I'm finding another doctor because every time I call, the receptionist is nasty." Now,
And that's not usually seen as something that would be connected to marketing.
but it's part of your brand. And so
Yeah.
what we do as a branding firm is we look at the whole picture to say, okay, I mean, we can design a beautiful website and make your make your brochure off the wall, but if they hate dealing with your office,
Right.
it's not going to help.
Right.
So what we try to do is kind of get under and get into the layers of where you're running into problems, how your office is working, and you should be doing an audit. You should be checking in. You should be calling in as a client,
Mm,
going in as a client, seeing how your office works when you're not looking,
mhm.
seeing what kind of experience they're having, so that you're certain that it's a positive one.
Right,
Because at the end of the day, nobody wants to go to the doctor. Nobody wants to go
right,
to the physical
right,
therapist. They're there because they need to be there for whatever reason. The more pleasant the experience is, the easier it is. The more helpful the staff is, the more likely A, you're going to keep those patients, and B, they're going to be what we call brand advocates,
right.
brand ambassadors, where they're going to tell the world, you know what, this doctor, their office is amazing. Every time I go there, they do this, they do that. They're always on time. They're always this. I know it seems silly, but it's the base.
That's the word of mouth part.
That's what makes is going to
Yeah,
make somebody loyal to you. That's what's going to make them want to stay with you, and that's what's going to make them refer other people to you, which
right.
is ultimately your goal. So that's the very, very first thing.
So we're so we're
An
not even
audit.
talking
We're not
technology or
even talking
anything yet. This
technology.
is
An audit
or
of how
tactics
you
or whatever. This is just
exactly.
basic. Yeah.
Basic, and you'd be surprised how many medical offices do not think of the patient experience when
Yeah.
they deal with even something as simple as how their office is laid out.
Yeah.
You're sitting in a waiting room. Is it pleasant in that waiting room, or do you feel like, maybe it's just a coat of paint? I mean, seriously,
Yeah.
it's that.
Yeah. Yeah. I remember one situation where I was sitting in the waiting room for a long time, and then they brought me into the treatment room and left me waiting in there for a long time, and it was freezing.
Right.
This was years ago, and I
Exactly.
still remember it. So it's
Exactly. And
yeah.
what was your inclination to go back and see them again?
I didn't. I found another doctor.
Exactly. I mean, and that had nothing to do with the brochure or the
No.
website or anything else.
No.
Like I said, the marketing can only take you but so far.
Right.
There are things that you can do, simple things, just by opening your eyes and looking around your practice and saying, okay, maybe that's not such a hot idea. Ask your patients,
Right.
what do you like about what we do? What don't you like? How could we improve? How could we make your experience better, more pleasant?
Hmm.
You'd be surprised how much it also makes them feel like you care about how they feel, because there is a perception they're just,
Right.
we're on a conveyor belt,
Right.
you know, in and out.
Definitely. Definitely.
So that's where you start.
That's a
Once
big one.
it's a big one. It's
Yeah.
a big one. Once you get those done, then you have other things like your website. And yes, you need a website. Absolutely.
Are
Doesn't
there
matter if
still
you're
people
like
that don't believe it?
there are. And there are quite a few in the medical field. You
Right.
need a website
Yeah.
because people, when they look for something, they Google.
Yeah. Yeah.
It's how you find stuff now. Nobody goes into a phone book. They Google. They want to know information. So you need to have a website. The website needs to be good looking and functional.
Uh-huh.
You need to be connected to online directories so that people can find you, and make sure that it's when they go on their phone that they can see your site, that it
Hmm.
changes, that it's responsive
Right.
to the mobile technologies, and that it's, again, user experience.
Hmm.
If it freezes every time they get on it, you know what's going to happen.
They're
So
gone.
they're going, they're going, and it also gives you the opportunity to make your practice more personal, so
Hmm.
that you can make it more than just, this is the doctor I'm going to see. Oh, this is the staff, and she's got a Rottweiler, and on the weekends they like to go skiing, and show them who you are, show them who they're dealing with. It's just, again, another way to endear people to you, another way to make them feel as though they're part of they're important.
That's interesting because it almost seems like that might be another thing that people would be afraid to do,
Yes,
especially in,
yes.
these kinds of businesses.
I mean, you don't have to put your address down,
Right.
but I mean, uh, something that gives you more of a sense of who you're dealing with,
Right.
to personalize the experience,
Yeah. Yeah.
to make it more about a community feeling, a feeling
Right.
of, well, it's not just walking into the doctor's office. You pick up the phone, you see the doctor, you go, hi, hey, how you doing? Did you go skiing last
Right.
weekend?
Right. Yeah.
Again, it's, but those are the things that make are going to make your practice more important
Hmm.
or more special or more memorable,
Right.
that will keep you. Because, all right, if at the end of the day you don't have a specialty that stands out any different than the other 15 chiropractors that are in the 2 mile radius, what makes you different? Why
Right.
should someone choose you over somebody else?
Yeah, because
And
I get that question a lot is, when someone's trying to decide, okay, am I gonna go here or go there or buy this or buy that? It was like, why should I get this instead of that? And
right,
and sometimes, of course, it can come down to money or service or whatever.
of
But
course,
but you bringing up a good point that sometimes it's just the fact that there's some sort of connection that you
there's a
feel
connection.
like you like the person a little bit
Right,
more for whatever reason. And like you said, it could be
right,
something as silly as both of you enjoy skiing or something like that,
right.
which maybe has nothing to do with what you're buying from them, but it
Exactly.
could just make there be more of a connection.
Exactly. Exactly. And I know that in the United States, the medical industry tends to be much more, it's more regimented. But for example, in Europe, you go to the doctor, they're asking you questions. How are you doing? How have things been? And I mean, you may sit in the doctor's office for 15 minutes. He may not even look at you for the first 15 minutes.
Right.
He just wants to get a sense of how you're doing. He wants to get. And I know we don't have that. Our system is different, and there are more time restraints and things of that nature. But you'd be surprised at just that sort of warmth,
Yeah.
where it's not just, so what's wrong? Are you
Right.
hurt here? What's wrong? Where you that makes that much of a difference.
Yeah.
Just to be able to, so it's the little things.
Hmm.
It's the little things. What you can do within your practice that will allow you to make the connection with the patient that will then make them more loyal to you and want to bring people to you.
Hmm.
The doctors that I love, I refer all the time.
Right. Right. Right.
I broke my wrist when I was riding and horses, and I had a physical therapist that was just, he was so amazing.
Mm.
And I can't tell you how many people I referred to him
Wow.
because he was great.
Wow.
I mean, you want to have a great feeling in a situation where it's not necessarily going to be so great, but try to make it better,
Right.
you
Right.
know? And it could be the phone conversation. It could be having the secretary who answers the phone not be rude,
Right. That's
or take that
right.
extra step.
Right.
Oh, you're having trouble with such and such. Let me see what we can do to, whatever.
Right. Right.
You really need to get in. Let me call. It's the little things, and your team should be on board with that. Like
Right.
the staff should know this is what we're doing, and it should be part of the brand. It should be part of the daily sort of going about business,
Hmm.
how you do business. It should be incorporated into
So you don't
that.
really have to think about it that, oh, I have to do that. You know that this is the way that we
This
do
is the
things.
culture.
Right.
This is
Right.
the culture of this office, and
Right.
this is how we do. You don't have people who do that; they don't stay.
Right.
You
Right.
see, because at the end of the day, it's going to affect your business. It's
Hmm.
going to affect your practice, and your practice is still a business. It
Right.
still needs to function like a business.
Right.
You see, so you still have to think about all of those other things at
Hmm.
the same time. So things like a website, things like email marketing or a direct mail. You know, sending out a newsletter
Hmm.
that says, hey, we did X, Y, and Z. We've got something new coming out. Or did you know that the flu shot needs to be da 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 da? Or did you realize that we have a new mechanism that can read some, you
Hmm.
know, biofeedback things that, all kinds of,
Right.
right. Okay. So again, making that connection, continuing to to keep the patient attached to you in a positive way,
Right.
where they want to come back and they want to refer other people to
And
you.
you bring up about the newsletters or other. I'm just laughing because I just saw somebody go by.
Oh,
It was a little cat. Is that what is his or her name?
I don't know
It was
who.
a cat.
That's Tibbs. He's behind me.
That's cute. Just open the door and come on in.
That's funny.
That's part of the staff, right?
There you go.
So, you just brought up about, staying in touch, and And I was just talking about that recently with someone in the office here, and it was related to healthcare. That
Right.
if you don't, sometimes you don't really want to go to the doctor so much. So if you don't get that reminder, say even about a physical,
Right.
you probably know, and I know people who would say, "Oh, I haven't had a physical in 3 years" or something like that,
Right.
which is not good,
No.
but you might be more likely to make that appointment if you get a reminder, and some people don't send reminders out, even for
No.
things like that.
Well, yeah, exactly. And then they should, because reminders are important. Hey, you need to come for your checkup. It's been a year. We'd love to see you. The dentists do it all the time.
Yeah,
Doctors don't do it.
yeah, interesting.
I don't think I've ever gotten one from a doctor, and it doesn't make any sense.
No,
Why? I mean, yeah, no. Okay, granted, most of us don't want to go to the doctor.
right,
I don't want to go to the dentist either, but it doesn't change the fact that sometimes I need to go. So if it's time to go, you go. But again, it's just making that connection. Because if the experience is not an unpleasant one,
right,
you'll be more inclined to go, to make that follow-up visit, to go do the things that you need to be doing. And
right,
again, it's about the user experience, the
right.
patient experience.
So you talked about like newsletters and notice. What other things that might you have people send out?
So I suggest direct mail campaigns, um, because the industry has shifted a bit,
Hmm.
and now we've got a million emails in your mailbox. And believe me, email is still a very, very effective way of marketing, but there are other ways of marketing as well. And think about it: you don't get as much mail in your mailbox these days.
Right,
Space.
right.
There's room
Uh huh.
for you to send out a quick note, a reminder that says, "Hey,
Uh
you're
huh.
due for a checkup," or "Did you know we just got, we were able to, we got a new service in, and come by and check it out,"
Hmm.
or "We got a new doctor on staff, and come visit and meet him," or whatever,
And a lot of
whatever.
a lot of practices wouldn't even have like a huge list, so it's not really that big of a
Right.
deal to send it
It's
out.
not going to be expensive. Right.
Yeah.
Exactly.
And if you
Exactly.
do have a big list, you could probably like segment it and maybe not send
You can
everybody at the
segment
same
it.
time. Uh huh.
There's a lot to talk about when it comes to lists and those
Right.
kinds of things. But the idea is that you stay connected.
Right.
I mean,
Right.
that's the theme. Stay connected. Stay connected when they're there. Stay connected when they're not. Make sure that connection is strong, and that they want to interact with you, because
Hmm.
that, more than anything else, is the most important thing.
Okay.
And there are, a number of things that you could be doing to make that happen, but you should be writing. You should be writing blogs. You should be writing articles, so that when people go onto your website, you have information to help them.
And
Gives them another reason to
a
visit your
lot of people
website.
say, "Oh,
Because,
I don't know what to write. I can't write." What do you tell them?
well, it depends. But it depends. I mean, we can help you.
Uh
We
huh.
can guide you in that direction. But you know who your patients are, and what their problems are, and what their questions are. They ask you these questions every day. Every time you sit down with somebody in an appointment and they ask you some question, you have the same questions over and over, often. And then you have other. I mean, these are the answers. You're right. You know what? We're always getting this question about the types of foods that you should eat to lower your blood pressure.
Right.
Okay. Or we always get a question about, if you've got, whatever. You know what I'm saying?
You're right.
So I mean,
And
you
it
have
doesn't have to be a book. It's
no,
just because people don't
just
usually
they don't
want to
read
read a
books.
whole lot anyway. So
But
if you
it's
get
quick.
the paragraph or something like that, it's enough to give some
Right.
information, but not so much that they're not going to read it.
Right, exactly. Enough to just say, this is a question that we get all the time. It could even be, like a Q&A kind of thing.
Hmm.
Questions that we get from our patients, and you post it on the website. I'm throwing out ideas here, but you post it on your website. These, each week you put a different thing up. People want to know about this, and so here's our answer.
Hmm.
What are some how much exercise do you need a day to maintain your weight? Or, you know, I've recently broken my wrist, and what are some of the exercises I should be doing to whatever?
Right.
You know what I'm saying?
Right. Right.
So
That's a good one.
it,
Good one.
that's it. I mean, so it's just a matter of taking the time to think about what your patient's needs are, what their common pain points are, their common concerns, and address them in all aspects of your practice,
Right.
whether it's sitting in the office, picking up the phone, at home, when they're visiting. It's about knowing who your clients are, knowing who your patients are, and helping them in more ways than just sitting in front of you at the appointment.
Right.
Because that's what's going to make them love you. And you want them to love you.
Hmm. Sounds good. So, let's see. Did I miss anything? Any other tips you wanted to share with us?
Oh, there's a
There's a
million. We could
million.
go on forever, but I think to recap it,
Yeah.
we have the patient experience
Right.
as a starting
That's
point.
where to
You
start
have
with.
direct, right. You have direct mail and email campaigns. Your website, which should be up to date, beautiful, and functional,
Uh-huh.
and you have online directories.
Right.
So make sure that your all your information is up to date, and so that when people look for you, they find you and it's accurate. And I mean that's where you start.
And
I mean, like I said, there's a million.
right.
This is what we do.
Right.
So there's a million things that you could be doing, but the takeaway should be yes, you should be doing this
Uh-huh.
if you want to grow your
Right.
practice. And no, it's not a bad thing.
Right.
It's things that you should be doing to keep your practice healthy
Great.
and grow. Yeah.
And just tell us a little bit about your practice.
What we do. Right. So my company is 3D Studios, and we are a brand management firm. So we specialize in the things that we've been talking about today,
Uh-huh.
helping businesses to grow, helping them to find their voice and to market in a way that's going to be effective for their companies. We've been in business for 20 years, so we've been doing this for a long time. We're celebrating our 20-year anniversary now,
Congratulations.
and thank you. And we love what we do, and we're
Uh-huh.
very good at it. So I mean, if you have questions or anything like that, feel free to reach
And
out.
how do people
Uh, our
reach out to
website
you?
our website is www.3, it's the number 3, dstudios.net. Or you can give us a ring at the office, and it's 914-304-4229.
Okay.
And you can email me directly. My email is Monica, Monica, at 3dstudios.net.
Okay, well, great, and thanks for agreeing to talk to me today and
Hey,
sharing
thank
some
you for asking
information
me.
with with my clients, and I'm sure it'll be helpful, and hopefully they'll take you up on some of those tips, and if they can't figure it out themselves, they'll
Feel free to ring.
contact you and get some help.
Excellent.
You're
Thank you again,
welcome.
Harris.
Thank you. All right.
Okay.
Take care.
Bye-bye.